are debating getting rhinoplasty and not sure if it's the right option for you, then this interview is something you need to hear.
Oh, joining us now for more in the sponsored interview is Dr. Douglas Henstrom, board-certified ENT and facial plastic surgeon of Utah Facial Plastics. Welcome back, doctor.
Thank you very much. It's great to be back here. I was just mentioning to Nisha, the first time I came on your show 7 years ago, we were talking about rhinoplasty. So here we are again.
Well, here we are. Yeah, so nose jobs, but also that there are non-surgical options for people as well.
Yeah, we get this question all the time. A lot of people don't want to go through surgery, so what options do they have? And there are options because there's a range of surgeries or interventions that we can do on a nose. One of them, the least invasive thing that we can do, is use filler to help add to the nose and help hide some of the defects that people might have. So it's referred to as a liquid rhinoplasty or a non-surgical rhinoplasty.
And typically, where are you putting that in?
A lot of the time, it's going to be up at the bridge of the nose. So you can see here, we just hide the hump by adding a little filler along the top of the bridge of the nose, maybe a little bit at the tip, and we can see better slope to the nose and help the nose. Now, we're adding volume, so not all noses can take this. If it's a big nose already, we're not going to reduce the nose with filler. We can only add to it. So not everybody's nose is a good nose for it.
And is this temporary, or do you have to keep maintaining it?
It is something that's filler typically in the nose is going to last for around a year. So you might have to come in annually and get this done and redone. But it's okay. It's still a very good option for those people.
Dr. Henstrom, when it comes to making changes to the nose, what are people usually seeking to correct?
Yeah, great question. A variety of things. Obviously, we think about the aesthetic or cosmetic things that people don't like about their noses, whether their nose is too large, they have a big hump is something we see. Maybe the droop is drooping, or the tip is drooping, and the ala are too wide. And then there's also functional aspects. People aren't breathing well. People can't. You've had this experience.
This was me. I just had surgery there a year ago on my septum. Yeah. Completely deviated septum, and my nostril shut on one side, and has been something I've struggled with since I was a kid.
Yeah, sometimes septums just do that, whether they just develop that way as a young child or there's trauma, and you can get the edge of your septum offset right there, and it blocks your nostril, and you can't breathe as well. So functional surgery is a big part of any rhinoplasty. We have to consider that because we don't want to do a rhinoplasty and compromise function. Here's an example of trauma to a nose where we can reset the nose, re-break it, straighten it, also do a septoplasty at the same time on the inside of the nose to straighten that septum like you experienced, Nisha, and help a person breathe better.
And there could be people out there who say this could be covered by health insurance because this is functional.
Yeah,
and
those
those might be the thing that gets them in too.
Yeah, those aspects of nasal surgery that we're trying to do to help them breathe better, like a septoplasty and stuff, those can be, we can work with insurance companies and help that.
All right, now let's talk about the rhinoplasty.
Yeah.
What is that entail, or what does that entail?
So rhinoplasty is changing the outer look of the nose, the external framework of the nose. When we're doing this as rhinoplasty surgeons, we're really working on the bone and the cartilage of the nose. Here's an example of one that I did. You can see the pre-op views around the nose. This girl obviously was very self-conscious about the size of her nose and how big that hump was. And it was very congenital nose. But the critical thing about her nose is we're making a lot smaller, a lot more aesthetic, and you can see this change again. It's critical for us to also think about how we're going to do this and not compromise her function. She needs to be able to continue to breathe just as well after, even maybe a little better than she did before. So it's critical when you come and see somebody that you see somebody that knows what they're doing with the functional aspect of the nose, because it doesn't matter how good your nose looks. If it doesn't function well, nobody's happy.
You're going to be miserable, and that change is dramatic.
Yes.
Wow, I bet she is so pleased and so happy about that.
Oh yeah, absolutely. You can follow her on all of her social media platforms, and she talks about it all the time.
And talking about it.
Absolutely.
That's a mental health issue too for her.
It is. It is. This was something she struggled with, and she is an amazing person, the nicest, kindest person, a concert pianist. But this was something that dragged her down, and she's become just this most outgoing person since then. She's wonderful.
What's recovery like for a rhinoplasty?
So a rhinoplasty will take a full year to completely heal, to go through all the process of healing. But the immediate process is some pain, some discomfort. You're going to be laid up for a week or two. You're going to take some time off from heavy activities and so forth. The healing time really has to do with the swelling in the nose and taking the time for the swelling to heal. So there's things that we can do to help speed that along. People are usually back on their job within a week or two. We have limitations on activity level for a little while, but once they get back doing things, they can get back into their regular life.
And doctor, you just hit it on the nose that it's important to get someone who has that expertise. And right there at Utah Facial Plastics, you do have the certified surgeons, but also the function that is so important. We can't stress that enough.
Yeah, it's the benefit of being dual board certified in ENT and facial plastics, because we really get that background of functional surgery for the nose as well as the aesthetic. And yeah, at Utah Facial Plastics, we've got 3 of us there that are double board certified, qualified to do this work. There's nowhere else that does as many rhinoplasties as we do. I personally am doing 3 to 4 every week. I mean, there's no shortage of problems that people have with their noses that they'd like to see addressed.
I did not hesitate to go to Utah Facial Plastics for mine, and I will tell you, mine's functional, and I'm breathing so much better. If you would like a complimentary cosmetic consultation with the surgeons, everybody, this is also for hair restoration. You can call right now, number on your screen, website on your screen. This goes till the end of the month, so go in, make that appointment this month and see if it's right for you. And our thanks again to Utah Facial Plastics and Dr. Henstrom for sponsoring this interview. Good to see you.
Great to be back.